Good evening. Welcome to Healing Quest. I'm Deborah Arneson, your host for tonight. We have a great show once again for you. We have back once again this evening for you Ann Richmond and Marty DuBois, and we are here to talk about neurofeedback, which we talked about a bit last week in regards to women and adults, and today we're focusing on ADD, ADHD, and autism in children, and assessing correctly, and diagnosis, and what this protocol does to help your kids, and to help you as parents help your kids without drugs. So this is a very exciting show, and we can't thank you both enough, and your mission in life is just such a wonderful, blessed mission to help parents and kids really get off drugs or stay off drugs and to be assessed correctly, because so many kids are not assessed correctly. Am I correct?
Usually.
Yep. And you find I know we were talking earlier that depression and autism kind of, or ADD, I'm sorry, depression and ADD kind of cross over in some of the symptomatologies?
Absolutely.
What are some of the symptoms of ADD?
Well, the classic symptoms of ADD are being disorganized, being distractible, and being impulsive. And some of those symptoms can be seen also with children who are anxious or children who are depressed. Different.
Or kids who eat too much sugar, maybe?
Yes.
Yeah, that's possible
Okay.
too. And all, you know, in various combinations of those things, actually.
Also, it's also evident in a lot of children who have seizure activity or learning disabilities, or if there's some kind of brain injury. So the symptoms are there, and sometimes people just think it's attention deficit when there's other underlying issues that may not have been diagnosed.
So tell me about autistic children. How do you work with parents who have autistic children? That's got to be tough.
Well, it's a team effort, I would say.
It definitely is a team effort.
It is a team effort. The children are very sensitive and often have a hard time with new situations. So we have to be very careful to try to make sure that they feel comfortable in our office, and we've worked with children for a long time, so in general I think we do a pretty good job with it. They vary, though. The children vary a great deal, so sometimes sometimes it's very easy. They're just very cooperative, and they don't have any problems. Other times it's kind of a challenge, I guess I'd say.
So are you seeing a huge growth spurt in autism and ADD and ADHD?
We're seeing a lot of children who are autistic,
More and more?
they're across the spectrum. A big group of the children have language issues. You know, parents would like them to be able to speak more appropriately or to speak all together. So that's an important part, and we are able to achieve, some of that. A lot of children with autism are just so hyperactive, and they're on so much medication, and we have to work with that. And like Marty said, they're very sensitive. So you give them a little bit of medicine and the neurofeedback, and sometimes they'll get more hyper. Our one mom, within the first 10 sessions, dropped the medication by 15 milligrams.
That's wonderful.
So she was able to, so there's all these issues. And with some of our kids, we're able to, we like work in 10, 15-minute segments, and that's all they can handle, and
because it's too much stimuli.
Right. And
can you actually put the electrodes on them and accomplish the tasks without the child participating with the neurofeedback?
Most of them are pretty.
Well, sometimes they don't like the electrodes, but as far as once we get the electrodes on, yes, I mean they don't have to know exactly what they're doing, basically. They just have to, we have to instruct them that we want them to keep the sound beeping or whatever the sound is that they're listening to. And that's enough that the brain sort of takes over
Ah,
subconsciously.
so they just watch and fixate then? and
Well,
start working
sometimes,
it?
or sometimes they occasionally they do other activities while they're still listening, and it keeps, and it seems to continue to work, actually.
That's wonderful. What age range do you work with kids?
Well, we've started as, I've worked with as young as 2-year-old. Right
Really?
now we have a couple of 4-year-olds.
What would you do with a 2-year-old?
Basically the same thing,
Behavior
Mom.
problems? Or?
Well, yeah, kids who are crying a lot, who are, you know, colicky, or somehow the moms and, you know, parents know that there was some, you know, maybe birth injury.
Or injury from vaccines or whatever?
Yeah, right. And so
And
they'll,
sleep issues is another
yeah,
big one.
you know, some kids just don't
Sleep. Ooh. Ooh.
Right.
Not good for anyone,
No,
including baby.
no, right.
Yeah, and we wish the parents would actually do the neurofeedback also, so that they could recover from the stress of having a child so difficult, you know.
So it really
Sometimes
helps with
they do.
sleep patterns too.
Oh, absolutely.
That's wonderful. Huh.
Sleep.
I actually sent a girl to you as a stewardess who hadn't slept in like 30 days. She came into my clinic. She was a train wreck.
Oh my goodness.
She was a train wreck. She had some kind of virus or something and couldn't sleep. Never recovered from the virus. So we did Shirodara on her. And I gave her calcium, magnesium, 4 of it, and I gave her Calmatrol and Rescue Remedy, and she slept for 2 days. But then she got back out of the cycle, because flying back and forth across the continent really upset her clock. So I don't know if she ever called. But yeah, that's interesting. Do you work with infants?
Well, we haven't, but we know of other people who do, and or who have a 1 or 2 cases, and we have heard of a person that sounds very intriguing, that they worked with the mother who was holding the infant.
Right, as a surrogate.
And they received the neurofeedback, and and they were so calm. You know, the mother was calming themselves.
The energy,
so
yeah.
the child became a very calm baby.
Isn't
actually.
that great?
Yeah.
How wonderful.
So it would be fun. We haven't done it, but we'd love to work with people who have colicky infants or something like that in that way. So
okay, so we're putting on a call. It's an APB for colicky infants, folks. Give us a jingle, and I'll let you know how to find and Marty. So when you work with pregnant mothers, what happens with the fetus?
Well, that's pretty much what this was about, is that the mother was under a lot of stress. And
While pregnant.
besides pregnancy, there were other issues going on, and she came for the neurofeedback treatments. And when she finally, and they could feel that the baby that had been kicking and doing it, having an awful lot of activity, suddenly calmed and moved in a calm manner. And then after she was born, she was a very calm child.
Isn't that wonderful?
Yeah,
Wow.
so we
So everyone should come see you while they're pregnant, that's for sure.
babies, for sure.
Oh my gosh.
And pregnant moms, right.
What are the effects of ADD and ADHD on the child?
Well, the child, first of all, of course, oftentimes they have some sort of problem in school, paying attention and accomplishing what they need to do. But it goes beyond just school. I mean, that's often what brings them to us. But often they also have problems getting along socially with because they're impulsive, and they that's a big problem. And then it sort of gets into self-esteem and that sort of thing. So that
Well, how do you assess them? I mean, what are some of the signs and symptoms tried and true of ADD, ADHD? Are there like 4 markers that are always there, or 3?
Our job basically is not to assess particularly. Most of the time, by the time children do come to us, they have been assessed by a neurologist or
But
other
let's say
doctor.
some of our viewing audience has no idea if their kids have ADD or ADHD, and they're having trouble in school. What could you say to us right now that would be some signs and symptoms? Are there clear-cut signs and symptoms, or are they variant?
I think there are signs and symptoms that are important to address, whether it's because the child is ADD or depressed or some other thing.
Or stressed.
Right, exactly. Right. We're not sure, but just by knowing what the symptoms are, you know, like because they can't focus, because they can't finish their work. Those are good signs that might be ADD. But the whole issue is it's a problem. Whether it's ADD or depression, it's still a problem.
Right, or stress.
And so one thing we do is we kind of we look to see, is there an pattern of over-arousal or under-arousal, or some sort of inability to control their
environment.
Themselves. Yeah.
Right.
Well, not pretty much their own within themselves. And that, plus we also do a sort of a, I guess we call it a mini-map, or an assessment, a brainwave assessment, and we can get some clues as to where the problem may lie. If, for example, there's an imbalance on the right and left, in the right and left prefrontal area, we might suspect there's some kind of vulnerability to depression or something like that. If not, then maybe not. So there are certain things that we can do by looking at the brain waves around in different areas to help us.
That's great too. So there's no textbook classic, like just generic diagnosis. You guys are very user specific when you work with kids and adults.
There isn't a blood test or anything like that that could say, okay, this is ADD.
Right.
What medicine does usually is they say, well, if Ritalin works, that means it's ADD. If not, it's not. It may not be. You know, that type of thing.
I was reading up on Ritalin about a year ago, and I found out that Ritalin is carcinogenic. Causes cancer.
There's been some articles about that.
Causes cancer in kids' livers. That's horrible.
Yes.
I can't believe that so many kids are on the darn drug.
Well, they've developed a few others, so.
I'm sure they have.
But we don't know what the
effects are.
Exactly.
Well, we don't
especially
know
in little
effects.
tykes. That's too bad. So what are the effects of ADD and ADHD on the parents and family?
Well, that's a big one.
It's a broad one, broad answers here.
You know, parents feel like failures a lot of times. Outsiders who don't know the child will say, what a poor parent this person is. Look, at can't control the child, you know, and so, you know, feel they haven't disciplined the child appropriately, and those factors are not true. The other thing is that a parent will feel very disappointed in themselves. Why, you know, why has this happened? Why can't I control this child? They'll possibly even be disappointed in their child. You know, why is this kid behaving this right? Yeah.
Tough.
They certainly didn't expect to have a family that was this chaotic, you know, that's pretty much, and so difficult. And it's hard to see that, especially after years and years of trying to deal with it unsuccessfully, a lot of times the relationship is pretty deteriorated, yeah. And it's too bad, you know, that they couldn't have maybe found something earlier. Sometimes they try, but it doesn't. Yeah,
that's tough. So it just really wears away at the core, the fiber of the family.
And a lot of times the siblings also are affected, you know, very significantly, because they're not getting as much attention as the affected child, and they feel left out, and they're sometimes embarrassed by their sibling, you know, the sibling's behavior. So there's a lot of, you know,
interplay.
A lot of interplay going on.
Now, what are the effects of ADD and ADHD on adults?
Well, adults...
it has to be a little different than kids, because adults have to conform more and fit in better.
They do, and they have strategies usually. Either that, or they just kind of, they're on the fringe of society, right? I mean, there are plenty of people like that. But if adults can have strengths that they can draw on, they can sometimes have strategies to kind of get around it. For example, a lot of times people will choose a career that is that they're more able to do. usually it's a career that can be is fairly exciting or something like that. They're not going, you know, they're not going to be a they might be in the emergency room instead of being a pathologist or something, you know, if they're going to be a doctor.
Right, so
you know, they're going to
float
be
around more, yeah.
you know, something that's really pretty exciting that will keep them high.
Keep their attention.
Yes. So that happens. But maybe they're okay with their job or maybe not. Maybe sometimes people really do have trouble keeping jobs because they can't stay interested in what they're doing. They keep switching, or they, you know, it's always there. They get, or they have difficulty with being impulsive, and so they make bad decisions, or they say they insult the boss or something like that because they're not careful about that.
About their words.
Right. And so there's a whole range of, you know, different things that can be affected by ADD. Also, certainly their interpersonal relationships, you know, with their family, that can be very strained because they might be disorganized. They might be, a lot of times I've seen people who, you know, they do okay as long as there's not too much on their plate, but then it's, they get too much and they can't handle it, and then they get irritable, and the kids, you know, feel it, and then the kids react to that, and it's
Catch-22.
Yeah, sad.
Wow. But so the neurofeedback helps with all of that. Now, when you work with ADD, if somebody is lightly ADD, if you can call it that, or generically ADD, then they would work with you how long to start to see results?
Well,
Is there a lot of gratification in the time frame?
yes, usually a child that is just ADD, okay, will normally average about 40 sessions, which is about 5 to 6 months' time.
Okay.
And they'll really benefit. We'll see results within the first 5 to 10 sessions.
Okay.
It'll be minimal, little results, but we keep building on that and building on that. And with children, because they learn so rapidly, it tends to really become a part of them easily.
Do you work with OCD as well?
Oh, yes.
You do?
Yeah.
Okay.
A lot of children with attention deficit have these OCD or maybe
Bipolar?
we have children who are bipolar. Work with that.
So what about like even adults who have like addictive behaviors? Would it help with that, the neurofeedback?
Yes, it's actually, of course, that's a complicated thing, and there are a lot of programs out there that, you know, are needed to help them work on those sort of issues around, you know. But apparently, what we know is that it helps with kind of the craving and keeps that down, and it can help with the program. And
How
it can
about
help.
smoking? Would neurofeedback help with smoking?
Have you had that experience?
I haven't had experience with that, so I
That'd
don't
be interesting
know.
to work on too. Because look at it, so most addictive habit, people can never stop smoking. I mean, rarely. You know what I'm saying? It's like they stop, they start, they stop, they start.
Right.
It'd be interesting. And what
haven't-
area of the brain does smoking affect? I wonder.
Not
Well,
sure.
I'm sure it
Me either.
affects the whole brain,
Well, sure, the whole body.
the whole body.
But what area of the brain is for satiety? Like where you feel satiated after like either drinking or...
People respond differently to, you know,
Stimuli.
to stimulants and so on. Some people can't drink at all, you know, they'll fall asleep right away. Some people can drink and drink and drink, you know, and so on. The same thing occurs, I guess, with smoking. Some people can stop it themselves, but I'm not too sure I know particularly an area that is affected, you know, that we would be
It'd be cool
dealing
to
with.
find out, wouldn't it? To see if like you see more disturbances in different areas of the brain.
They tried to work with people who, you know, obese people, what causes overeating, and as of this time, I don't think I know if they've pinpointed it yet. So
There have been some people doing what we call QEEGs, quantitative EEGs, where they use 20 electrodes and they get a more precise map
picture.
of complete
Yeah.
picture. And there, some of the people have been showing different patterns for like, for example, alcoholics. Some alcoholics have one type of pattern where they have a lot of really fast waves, and other other people show a different pattern. It makes kind of sense because some people drink to calm down, some
to speed up,
or to be more uninhibited and things like that. So,
interesting.
Yeah.
Huh? Can you do 20 electrodes on people?
We're not doing the Qs in our office, but we do have some colleagues who do it, and we usually refer them.
Okay, tell me about the effects of autism on children and families and how you can help them. What have you done so far?
Yeah.
Share. Share. Okay, because this is exciting.
Well, autism is usually a child is, as we said, is very hypersensitive. Sometimes they just can't take loud noises. They can't take stimulating situations. That, they go nutsy, you know, and so basically, what it does to the family is that it's very
extremely stressful for families.
Yeah.
One of the things I think you should share is, for example, some of our kids who are starting to babble and stuff when they're not talking, becoming more playful, having better eye contact, just being more communicative, more sort of observing the environment a lot more. We have a 10-year-old child who was exposed to alcohol prenatally, and he was very really severe in a lot of ways, that he couldn't really observe what was going on around him very well. And now we've enjoyed him so much because he comes up with questions that are very insightful that we didn't expect at all from him, and it's really, for us, it's such a pleasure to see this change in these kids.
Yes. Isn't that wonderful? And how many sessions did it take before you started to see some of those changes?
Well, when we start to see changes, we start to see changes probably in 10 sessions. But over, I think he's been with us about 6 months or so.
Yeah.
Twice a week mostly.
Did you get attached to these kids?
Very much so.
Yeah, I imagine.
Yeah, and the families too. And I think they feel really comfortable. They've mentioned a lot to us about how comfortable they feel in our office. And this is such a different feeling than the other offices we've been to and things like that. So it really makes us feel good.
Good.
We like to help them, in lots of ways. We do a lot of consultation in terms of, advice about how to handle certain things, or refer them to other types of treatments if we think that might be helpful, if we can.
Well, with autism, does the therapy wear off, or does it just get them to a certain level and then they stay there and then they would come back later and do it again? Kind of like peeling the onion away.
Well, it can. I mean, I have one child who's 4 years old, and his mom has been bringing him for a while, and he comes, does maybe 2 months of sessions, and then she stops for a while, and then she brings him back again. So
is that due to costs, or
because of what?
Does it have to do with the cost of the sessions?
No, she works a very difficult job situation, and she just gets worn out.
And she's coming from a long distance too.
Yeah. So.
Right.
So the drive is hard.
Yeah. So she does that. Other parents just keep coming and coming, which is wonderful because, they want to see their child succeed and do something, be more successful. And
isn't that wonderful?
Well, it's just so gratifying to see the changes that the children are being able to make. And you know, how that hopefully they're going to be so much more successful, you know, in their lives.
No, I know people are going to wonder real quick. Go ahead. I'm sorry.
Oh, I was just thinking about that child and how actually he was starting to talk and babble and sing and do things that
He hadn't
didn't.
done.
And then I think the doctor wanted to try an anti-seizure medication, and he started stopping all that.
Oh, yeah, shutting him down.
Yeah, and so actually she just talking and
That's great.
all of that. So
That's great.
He was in the office last weekend and was counting up to 6.
How old is he?
4.
Isn't that fantastic? Wow. Just amazing. Because autism, I know, has reared its ugly head in this country. It's grown by in leaps and bounds over the last decade. I don't recall what the percentages are, but I know it's huge.
Right.
Do you know? I don't remember.
Don't know. It's just major all of a sudden.
Yeah, it's like
Everybody's
an epidemic.
Right.
Back. What's the ballpark cost for someone like that, for a process like this, per session?
Oh, per session?
Mm-hmm.
Well, we started about at currently $80 a session. We do have some like a package that we so we charge a little bit less.
So people can get it down. And does insurance reimburse this?
Sometimes it does.
we try to.
If they come with a prescription from a doc, would it?
Well, we don't. We usually try to work with the parent, and we don't always need a prescription from the doctor.
Oh, no, no, I'm just saying if someone went to their doctor and received a prescription for the therapy for their child, would insurance then reimburse?
Not always.
Not always, okay. We've run out of time again. Oh my gosh. I cannot thank you enough, Anne and Marty. Thank you, thank you, thank you for being here. And to know that there's help for parents and children with ADD and ADHD, as well as autistic kids and people who are just having trouble dealing with their lives, you know, going through too much stress or depression, is just a huge gift. So my hat's off to both of you. Namaste. Thank you for being here tonight. And if you'd like more information about the Discovery Center and Anne and Marty's work and their good work with you and children, please give me a call. I'm Deborah Arneson, thanking you for joining us tonight. Until next week, take good care of your health and God bless. Good night.
Well,
that was fantastic.